The pandemic has affected them because those patients have to go in for daily dosing. They also have to have urine drug screens and counseling sessions. So we had to try to figure out how can we get all of that without exposing people to the virus. So within that, we've started using telemedicine and having the counselors to call the patients and have the counseling session over the phone. I haven't seen an increase, but the people who are going to the clinics are much more diligent with doing so and a little bit more personal responsibility. So, we've asked them to let us know if you've had an exposure or someone that you live with has tested positive, and then we've dosed them outside so they're not exposed to other patients in the clinic. I think that there's been a bit more personal responsibility by the patients, and that's always very positive. We want patients to include their family or any supportive measures that they are using that's working for them in their treatment. So, of course, people are more anxious because it's unknown, it's uncharted territory, but we've increased the number of counseling sessions if that's needed. We've offered different ways of getting your medication, such as the patient can have someone else to come to the clinic, get their methadone, and bring it to them. We've also been able to offer delivery of methadone to patients who are quarantined. So we've tried other ways to get people to remain in treatment. We've had lots of first responders in the clinic to test positive. So, of course, that produces anxiety, with everyone at the clinic. We've also made it a priority to get tested. And so we also have had to work with limited employees at clinics. I call it a skeleton crew, just enough people to get the job done because, we have people who are positive or they're quarantined or clinic directors who are out sick because of it. So we've really had to explore different routes and expand our roles to get the job done. I always tell people to remain in the moment. In this moment, I'm well. In this moment, I'm gainfully employed. In this moment, I'm not exposed to the public where there's a lot of unknown. It's uncharted territory for everyone, and we all experience anxiety. And it's just important to be able to have someone to talk to and to lean on and the support that you need. And it's not selfish, because if you don't take care of yourself, you can't take care of others. Take time to check on your coworkers, the people who you see every day at work, people that you often have in meetings and were not able to do so. Check on them and let them know that you care. But if you need to speak with someone, conquercovid.la or text reach out in all caps to 741-741. Reach out, stay well.